My name's Laura Bailey and I'm a dental therapist. I graduated in 2013 from Manchester University and I've been working in private dentistry ever since. Periodontal disease is perceived, in my opinion, as a daily frustration. It's a wholly preventable disease and with the correct guidance and compliance can be easily treated. Yet we find ourselves in this perpetual cycle of disease and destruction due to lack of resources, time and education. The general public see periodontal disease as normal. I don't think there's any chronic or destructive disease that is as blindly ignored and misunderstood as perio, especially not one that can massively affect a person's systemic health. It is really difficult to convey the true consequences of perio disease to a patient. It is a complicated disease with many silent symptoms. How often do patients go undiagnosed after not seeing a dentist for years because they have no complaints? Bleeding gums, one of the most obvious symptoms for a patient, is seen as common and harmless. It can be a real challenge to ensure a patient accepts the diagnosis and what this truly means. It can also be really hard to get a patient to own their gum disease and take responsibility. A change in ethos to having more patients understand that perio disease is not normal. It can be prevented and the role of their home care is the most important factor in this fight. This would not only decrease the amount of perio DCPs see, but it would also reduce the costs on the NHS and the economy that would normally be caused by chronic perio. It would make treatment simpler and easier. I think hygienists and therapists working with direct access will hugely help with the diagnosis and treatment of perio by ensuring patients have as easy access as possible to dental care. Being able to carry out a full perio exam, x-rays and treatment plan within our scope will increase patients taking up treatment. I always try to be positive, to create an honest relationship and not lecture patients. It is imperative we give our patients all the information and help them to understand their oral health, but we can do it in a way that is informative and motivational. I like to use social media to try and educate and empower the general public to improve their overall oral health. Since understanding that gingivitis is more closely linked to progressing to periodontitis than I previously thought, I've been spending more time educating those that I thought were lower risk. This will hopefully reduce the amount of people that go on to then develop periodontal disease. From my perspective, the HAP consensus gives us a clear and concise protocol to follow to protect and support our patients based on the latest evidence. Since the Hygienist Advisory Panel, I've integrated a clinically proven fluoride mouthwash into my protocol for patients I have previously struggled to see improvement. Although early days, the prospect of further supporting my patients at home is really exciting for me, and I look forward to seeing the results.